Welcome back. Today I have with me Dr. Regan Tilley, functional family physician. She's been in healthcare for over 29 years. Welcome, Dr. Tilley.
Thanks, Jessica. I'm so happy to be here.
I'm really happy that you're here today. I know you've had a lot of experiences. I would love for you to tell us a little bit about your work and how you've gotten here.
Sure. So, like you said, I've been in healthcare a very long time, and I've seen it from multiple different facets. Most recently, I have owned my own clinic, Whole Health MHK, which is a direct primary care clinic, and I predominantly utilize functional medicine tenets. One of the things I did to serve the community was jail medicine. I thought it was absolutely imperative that they have good care. So I thought, why not me? I have the time. What that did, though, was show me where we are struggling to help people heal. Right? Not everybody understands how significantly trauma can impact a person's wellness, both physical, spiritual, well, physical and mental, but spiritual as well.
Well, that's just really interesting, and I would love for us to talk a little bit about trauma. When we think about jail medicine, I think there must have been something very traumatic that got them in that position. Do you always work with people that have large trauma issues or in that space?
So what I did find is oftentimes it was the environment that they were in and the way that the trauma that they experienced was managed. So oftentimes the folks that I encountered in jail were not members of a strong family system. They often were marginalized. They were in foster care, on the streets, you name it, and didn't really have that cohesiveness that many of us grew up with that benefit us when we went through a hard time. It wasn't always the big T trauma, like environmental disasters, car wrecks, severe things. It could have been chronic, ongoing, what we call little T trauma that is just always simmering, and they just didn't have the resilience to come through it.
So how did you find this connection between trauma and health when you were in that space?
Sure. So in jail medicine, often what they asked of us was to do excellent medicine for them, provide exactly what it is that they would need, their medications, if they were diabetic, give them insulin, make sure their diet was appropriate. And that's conventional Western medicine. That's very acceptable. It's very normal way to take care of people. But with my brain being the functional medicine brain, I couldn't just stop there. What I needed was to dig deeper and figure out why this person who wasn't diabetic when they came to jail became diabetic, why this person is constantly being admitted or incarcerated related to mental health concerns versus, why do you keep doing the thing that gets you arrested, right? So we actually had frequent flyers in the jail, just like we do in the hospitals, right? And what I started to discern was these folks needed a mom. Like they needed somebody that just actually cared. I'm not gonna say certain words because I know this isn't, kind company and all of that, but they just needed somebody that gave a crap.
Yeah.
And that's what I started doing. So for 3 years while I worked at the jails, that's what I focused on. We would take care of their health needs, but we would also dive in to why they were there, what was going on in their life. Did they have kids that had gotten taken away? Did they have homelessness? Did they have food scarcity? Was it a drug charge? Was it literally they were cold, so they went and stole a little something because they needed a warm bed? And this is what I dove into. The nurse that was working with me at the jail was right on board, so we are a great team when it came to helping these folks out.
You must have provided so much relief for this. I can just imagine, I'm trying to think about the relief and to receive kindness like that in the jail system where there probably isn't a lot of kindness.
Well, I will tell you that was a challenge as well because these folks in the jail don't know how to receive kindness. It's like, and I'm not trying to liken a human being to a dog, but if anybody's dealt with a scared animal, they bite, they hiss, they claw, they growl, and they're scary. And oftentimes that's how I was initially met when I was digging a little deeper. And I only did it with permission. There were some people that didn't want to go there, so I didn't go there. But the folks who were receptive, it was beautiful. It's almost like you could kind of start to draw them out and they would come out of that defensive posture. Oftentimes we would have breakthroughs with tears and we would have like this relief, somebody's listening to me, and it was just really rewarding. Going through that with that population also opened my eyes to how much the general population deals with trauma, and some people are very adaptive and resilient, but there are different experiences that are maladaptive or very poor coping skills or coping mechanism related that I was recognizing, number one, in myself, as well as some of the folks in my clinic. And when I started diving into working on what they've been through in their life, the traumas they've experienced, this is where breakthroughs happen. And I'm so thrilled to be able to do that.
So now you've brought that into your practice.
Yes.
So
yes.
You started with your big aha when you were working with prison medicine, and then you brought it into your practice to even see big T, little t trauma. Either way, there are ways that you can draw people in and have them open up and receive medicine. So people actually need to be able to receive that medicine. And when we are working in medicine as we do, it is a challenge sometimes to allow people or get people to see how they can receive that medicine. So that's what you're working on in your practice.
Yes, I mean, one of my most exciting things to do is help people understand that what they have gone through in life is impactful. It's not separate from them. We are whole people, and that's the whole health is the name of my clinic, and that's the body, mind, spirit. That is so important for me that people understand. We can't just do the physical healing without doing the mental and spiritual healing. And so being able to broach that subject, and again, I always ask permission because sometimes these can be very uncomfortable experiences for people when they start opening up, especially to a doctor who their idea with mainstream medicine is it's a 5-minute appointment. You don't have time to hear it. I don't want to bother you with my issues. And if you bring it up, so often the answer is, here's an antidepressant or let me refer you to a psychiatrist. And in my practice, what people experience is your first visit with me is 2 hours. Your follow-up visits are an hour. Some people are like, I only need 5 minutes. Great. But you know what? If you need an hour, let's sit on the couch together and take an hour.
You practice something called direct primary care.
Yes.
So in that model, you can take a little bit more time.
Right, yes.
And it is an affordable model. It's something that people can still see you for when it comes to family medicine. And then functional family medicine, where you're taking care of that whole person, including that trauma space that you're talking about.
Yes.
That emotional health and wellness.
Yes, so I worked in conventional medicine up until 2020. During the pandemic is when I left my contract. It was over, and I decided I'm opening my dream practice, which my dream practice is there to serve those people in my community that want more, that want to dig deeper. And it allows us to come together and actually very much individualize what you need. It's not the checkbox cookie cutter medicine. It's totally different. People come in sometimes for their first visits, they sit there. I always make sure I have a Kleenex box because it invariably ends in tears that are much needed and very much warranted. You know, you need to feel that space of acceptance and safety and security. So I try to offer that in my clinic so that everyone who comes in feels welcome, accepted, as well as know that we will only go where you're comfortable going. And so if it's not going deep that first time, it's fine. We take all of the time that we need, and that's why my appointment times are longer. Yeah.
What I love is that you say, and then there are some people who only need 5 minutes. My presumption is these are people who have taken that 2 hours, then 1 hour, and then they say,
Yes.
I'm good. I just need to be here for my follow-up and to make sure that we're checking in and doing everything. That must be so rewarding.
It is, and it helps me understand that we are getting through some of those layers of safety, security, and stability, you know, that really foundational level that people need to be able to master in order to heal. And so often, like you said, in the jails, we didn't have any of that. We didn't have that foundational stability. So in order to thrive, people need to have a safe home. They need to feel secure. They need to have stability, and that looks like financial stability, home stability, relationship stability. All of those things are necessary in order for us to even think of healing higher up in our systems. So it's one of those things that I really truly love to introduce people to if they've never experienced that, because so often in conventional Western medicine, that's not how things are approached. And so that's my preference.
I love that. I think I can imagine as a patient walking in and then feeling that feeling seen, and also we dismiss ourselves so much, like, this doesn't really matter to me, like, oh, well, my relationship isn't perfect, or my home situation isn't perfect, but it's what I've got, so I'm going to plow through, and that can get you even sicker.
It does, and so often when I am looking with the patient through their timeline, we go through it together and we look at things that impacted their health, and so often it can be 6 months to a year ahead of their health crisis. There was something that happened, and this is where trauma comes into play. Again, you're not maybe an inmate who has been arrested and had that type of trauma in your life, but your dog died. You had a divorce, you had a car accident, you got really sick and had to go into the hospital. All of those things are traumas that can reset your nervous system into a loop that is not therapeutic, where you're unable to function to the peak of your ability before. So many people will say, well, I was fine. I never got sick. I was fit. I could eat whatever I wanted, and it didn't matter. And then you come into this space of, I had this thing happen to me, and I can't do anything anymore. So there's this sense of helplessness. So the rug was pulled out from under your feet. And so we elucidate that. We bring that into the light so that they can recognize that there was an event. This isn't all in your head. This wasn't all just an accident and coincidence. Something did contribute to where you're at right now.
Okay, and then help their path to wellness.
Exactly.
Dr. Tilley, thank you so much for being with us here today. You'll come back next week?
I am so excited to be here. I can't wait.
I'm really excited too. Will you
Yes.
please let everyone know how they can find you?
Sure. The easiest way to find me is on my website, www.wholehealthmhk.com. That takes us directly to our clinic website. And then if you want to go into deeper healing, which you'll learn more about in the next segments, it is the quantummetabolicreset.com. That is one of the places that I am set to help the whole world heal.
I'm really excited. I can't wait to check out your website. I just learned about it this morning, so I'm really excited.
Awesome.
So I'll see you next week.
I'll be here.
And thank you so much for watching. Stay tuned after these messages for our next guest.